So if we look at COVID-19 and obesity, and while we're seeing these things, as I said, I'm going to give you a few facts, and these are facts that you probably know, but I'm going to bring them up to you again. African Americans represent 12% of the United States population, but African Americans, because of the social determinants of health, are 30% more likely to have pre-existing conditions of obesity, and the obesity leads to diabetes mellitus, hypertension, heart disease, etc. 30% more likely to do it, and unlikely to be able to solve it because we don't have the tools that we need in our community in order to be able to solve it. Also, as part of this social determinants of health, we're overrepresented in high contact essential services. African Americans, we are the nurses, like you all, high contact with risk people. We're the grocery store attendants. We're checking people out. We're Uber drivers, we're delivery folks, we're policemen, we're on the front lines and overrepresented in high contact situations. And so we have the social determinants of health, such as obesity, hypertension. We have jobs that put us in harm's way more often than not. And we also live in high density population centers. We live usually more in the inner city areas where the housing may be smaller. Where we have multi-generational people living in the same household. It's not unusual to have grandmother, grandkids, mom, dad, nephews, etc., living under the same household, especially with the COVID-19 epidemic where people are losing their jobs, etc., etc. And so if you have a situation where one person in the house is infected, there's no way to quarantine because you don't have enough space, if you will, in order to be able to do that. And so you've got a situation where you are more prone to get the disease. You're more prone to have risk factors to make things worse. You're more prone to be in a situation where you're exposed, and you're more prone to be in a high density situation. And you got to go to work. You've got to go back and forth to work. And so if you got to quarantine, you still got to go back and forth, unfortunately, to work. And so these are the reasons why we see disproportionate infections in the COVID in our community, and it's also the reason why we're seeing more unfortunately bad outcomes in our community.